All right, so if you've hurt your back recently or hurt your back in the past, you know that a common reaction is to stop everything you're doing and let it just rest. Now, within reason, that is decent advice. It depends on the severity of your pain. You definitely may need to modify activities, but you don't just want to lay in bed all day. You don't want to completely rest from all movement. You want to, do some gentle, therapeutic, corrective-like movement. And believe it or not, even in the most acute, severe back pain episode, there are things that we call in our office first aid movements that you can do to start to quickly reduce your pain. And you can do it in a way that allows you to avoid pills, definitely procedures, and then obviously surgery is something that you want to consider last. But sometimes when people keep hurting their backs over and over again, they start thinking or they start getting told that maybe they need some type of surgery. Resting when your back is injured is a common misbelief that I want to kind of clear up. So I wrote an article about it. By the way, I'm Dr. Carrie Jose. I own CJ Physical Therapy and Pilates here in downtown Portsmouth, New Hampshire. We specialize in back pain. We're helping a lot of people right now with back problems, especially after the winter that we've had. All the snow shoveling and everything just kind of wreaked havoc on people's backs this winter. So our office is very busy right now helping people, perhaps just like you, if you're listening to this video and you've got back pain, get rid of it. But the one thing we don't prescribe is complete rest. It's not good. If anything, it can not only delay your recovery, but can actually cause more problems. So, and then besides rest, we're not really a fan of passive modalities in general. The only one that we kind of like to use in our office is regenerative therapy, because even though it's by definition passive because we're doing it to you, it's not passive. It activates your body's natural ability to heal itself. So even though it's done to you, it activates a natural process in your body. So it's kind of active, if you will. So that combination of regenerative therapy and the right, precise, corrective movements can really do wonders for your back pain. And not only get rid of the pain, right? We want to do that, but we don't want to only do that. We want to make sure you know how to keep it gone for the long term. So that's where those quote, first aid movements come into play, because if you're on a vacation, you're playing golf, playing pickleball, you're out doing your thing, walking maybe, and you tweak your back, and it's like, oh no, here we go again. That doesn't have to be like that. You can actually take an active approach and do something and put the progression of the back pain at bay immediately. You might be able to solve it completely on your own, but at least you can keep it from getting, really bad or lasting longer than it needs to. So it's a confusing topic sometimes. Most people don't realize that, you can heal your back on your own. So have a read of the article. Let me know what you think in the comments, and please definitely share it with any friends or family members or coworkers that might need to hear this message. I hope you guys are having a fabulous day, and I'll talk to you soon. Bye.